We're also keeping a close eye on Harvey's impact on Houston's hospitals and the medical community there. Take a look at the Ben Taub Hospital at Texas Medical Center, located in the nation's fourth largest city. This hospital now struggling to deliver care, rising floodwaters cutting off access, supplies, and food. Dozens of other hospitals in the region have taken steps to evacuate their sickest patients out of storm's reach. Joining us now is Dr. Mikhail Varshavski, known as Dr. Mike. This is one of the most critical pieces of Houston's economy. How can doctors in this area continue to deliver care with such limited resources?
You know, it's a very tricky situation, very difficult to plan for, because no one has seen a storm of this specific type of magnitude. It's so much rainfall, it's so much flooding. And we just saw a really great image of the Ben Taub Hospital, and that hospital is not flooded within. So the Texas Medical Center did a renovation of about $50 million after the storm in 2001. And after that renovation was done, none of the facilities of the Texas Medical Center are flooded. The issues come from the areas surrounding the hospital being flooded, which limits access of patients coming in. You think about how pun intended, flood of patients come into the emergency room for seizures, labor deliveries, anything, gastrointestinal illnesses. All those people now can't get to the emergency room because of the water. So you need access by boat, you need access by helicopter, but then the strong winds made it difficult for helicopters to travel. Right. And that puts such a difficult strain on doctors to give care, even though they're open and fully operational.
Another environmental threat or medical threat that's expected to emerge in the coming days and weeks in the wake of Harvey is water contamination. It's currently a major environmental threat faced by emergency responders. These are the water contamination concerns, also debris, animals, virus transmission, infection. What do you make of this? Because this is something that's going to need to be monitored and dealt with in the weeks to come, really. And it's one of the reasons you saw Anheuser-Busch sending cans and cans of water to the region.
Yeah, it's very difficult to deal with because you don't know what kind of viruses, what kind of bacteria are going to be present. It's all about how it gets contaminated. We've had some lessons from Katrina that really surprised the Center for Disease Control. They saw coffins floating during Katrina. They saw morgue bodies floating within the water. So you never really know what kind of contamination might happen. In fact, there was an outbreak within the shelters of tuberculosis cases during Hurricane Katrina, because when people live in such close proximity, transmission of anything is possible. The biggest recommendations we can give to people that are trapped or maybe surrounded by water: stay out of the water as much as you can, because drowning is a serious risk of life. Sharp debris that can open a wound on your body, which allows bacteria to enter, tetanus, MRSA, all of that. And if you do get a cut, if you do have some sort of infection going on, make sure you thoroughly irrigate with soap and water. And if you're going to be drinking water, make sure that you boil the water first. That's really key here. One
more question for you. What if you're on medications and when you're trapped, these medications can run out? What would you advise people to do in those situations?
So they have really good communication with some of the pharmacies that do deliver medications, and they're working with the rescue teams to deliver these medications via boat, via helicopter. And what the city of Houston did very well is that they planned ahead. So those who were on chemotherapy regimens that need certain medications given at a certain time, and it's a very timely medication, they planned ahead. So they either gave the medications early or they redirected them to an area that wasn't affected by the flooding. And you took care of those patients. But now you have dialysis patients that need to go 2-3 times a week to get services. They can't get them. What happens then? They're the ones that need emergency care. That's why all of these heroes that are traveling now to help, those people are the ones that are first going to be affected.
Yeah. So do they work with the CDC before storms like this happen pretty extensively? I mean, is that big an emergency protocol for them?
So CDC is involved with this. The Homeland Security Department's involved with it, because it's not as much as a disease issue in the beginning, it's the preparation for these things. And the big hospitals did a really good job preparing staffing-wise, because if you think about it, if you can't get to the hospital, how are doctors going to be there? The way that even during Hurricane Sandy, my hospital
were you working
I was actually working out of Lutheran Medical Center at the time. And what they do is they have staff come in preemptively and stay there and basically camp out. So all the staff that's in the Texas, Houston area, they're stuck there. They're being taken
So
care
how
of.
long were you at Lutheran?
I was in Lutheran Medical Center for about 3-4 days because they closed the Verrazano Bridge, and I was living in Staten Island at the time. So
and Lutherans out in Brooklyn.
Yep.
Right. Wow. That's incredible.
You guys are heroes. These.
Well, all the doctors everywhere are heroes.
Yeah.
First responders, doctors, they're doing an amazing job. And all the people that are raising funds, I can't thank you enough. You're doing an amazing job. You're helping a lot of people that are really limited in what they can do for themselves.
Dr. Mike, it's great to see you.
Thank you so much.
Thank you so much. We'll see you soon.
Yep.